So, we are heading into chapter 7, the circulatory system. This is a building block process, of course. So, you will rely on many of the roots, prefixes, and suffixes that we covered in week 1 to provide the foundation to support this chapter's content. So, our roadmap for chapter 7 focuses on, once again, three key areas. First, we'll look at the functions of the system. Second, we'll learn the structural terms. And finally, we'll look at some diagnoses and diagnostics and procedures to address. So, first, let's jump into the anatomy and function. When people hear circulatory, they almost always think about the heart or cardiac and blood vessels. Cardio means heart and vascular means vessels. But notice the addition of the lymphatic system, which is the second half of the equation. Lympho refers to clear lymph fluid. These two systems work in tandem to keep fluid moving safely through the body. So let's look at what these systems actually do. The cardiovascular side of the body's ultimate is the body's ultimate logistics network, delivering nutrients, carting off waste, balancing chemistry, stopping leaks, hemorrhaging, and regulating temperature. But pay close attention to the primary function of the lymphatic system. It collects fluid that escapes from the smallest blood vessels and returns it to circulation. Think of it as the recycling system. If your capillaries leak fluid into the tissues, the lymphatic system acts like a sponge to pick it up and dump it back into the bloodstream. This diagram visualizes the recycling process. Section B on the right, the structural hierarchy flows from large arteries to smaller arterioles to microscopic capillaries. At the capillary level, fluid escapes into the tissue cells. Then it flows back through venules and finally veins. Notice how the green lymphatic capillaries are interwoven right there in the middle. They are standing by to catch the excess fluid, extracellular fluid that the venous capillaries miss. So notice we have three terms for general vessel: angio, vaso, and vasculo. Arterio is an artery, but if we change it to arteriole, that suffix change indicates a smaller branch. So look closely at ATHER versus ARTER. They sound similar, but arthro specifically means yellow fatty plaque. If you know phlebi means vein, you'll instantly understand pathologies like phlebitis. So adenoid refers to adenoids. Cervico means neck. Context is everything here. We discussed this before, but in a gynecological context, it means the cervix of the uterus. But in the circulatory and lymphatic system, it refers to the neck lymph nodes. Homeo means sameness. Thrombo means a clot. If a patient has a condition starting with thrombo, your mind should automatically jump to blood clot. So arteries carry blood away from the heart. Remember, artery equals away. Arterioles are smaller and act as control valves. Capillaries are thin, one cell thick, making them perfect for exchange. Veins return blood to the heart because they don't have the high pressure push of the heart. They require one-way valves, so gravity doesn't pull the blood back down to your toes. Finally, the vena cava are the ultimate interstate highways, dumping all deoxygenated blood back to the right atrium. So here's just a quick knowledge check. Brain break. That was a lot. So this is the full body anatomical map. Don't let it overwhelm you. Look at how logical the naming conventions are based on location. The vessels in the thigh are femoral, near the femur. The ones in the neck are carotid. Under the collarbone, subclavian, sub meaning under, clavian meaning collarbone. If you learn your basic anatomy roots, vascular terminology becomes a map you can easily navigate. So this slide tracks the specific path of blood flow. In section C, we have deoxygenated blood moving from the vena cava to the right atrium, to the right ventricle, to the pulmonary artery, and finally to the lungs. After exchanging CO2 for O2, it returns via the pulmonary veins to the left atrium, then to the left ventricle, and finally to the aorta. So normally arteries carry oxygen-rich blood, but because the definition of an artery is carrying blood away from the heart, the pulmonary artery is the only artery in the body that carries oxygen-poor blood. Lipids are fats. Cholesterol and triglycerides are specific types of these fats. So if we look at hyperlipidemia, we can decode that. Hyper means excessive or high, lipid means fat, and emia means blood condition, literally a condition of excessive fat in the blood. So let's go on to diseases and disorders. Hypertension versus hypotension. Hyper is usually considered a condition when the patient is sustaining a blood pressure systolic of 130 and diastolic of 80 for a longer period of time. And then we have low blood pressure as in hypo. And this is a condition that can allow people to fall or faint. So vasodilation versus vasoconstriction. Dilation means widening and constriction means narrowing. Now look at the tumor terms. The suffix "oma" means tumor or abnormal growth. Therefore, an angioma is a tumor of a vessel. Hemangioma is a blood vessel tumor, and a lymphangioma is a lymph vessel tumor, all benign but structurally distinct. A thrombus is a clot that forms and stays put, stationary. An embolus is a traveler. It breaks free and it floats through the bloodstream. An embolism is the actual event of that traveler getting stuck in a tight spot and causing a sudden blockage. If this happens in the brain, it can cause a cerebrovascular accident, a CVA, which is the medical term for a stroke. So, arteriitis is an inflammation of an artery. Aortitis is an inflammation of an aorta. Polyarteritis is poly, meaning many. So, this is inflammation of multiple arteries. Now, arteriosclerosis versus atherosclerosis. So, sclerosis means hardening, but arteriosclerosis is the broad term for hardening of the arteries. Atherosclerosis is the specific type caused by arthur, the yellow fatty plaque we learned about earlier. An aneurysm is a dangerous ballooning or widening of a weakened vessel wall. Phlebitis is phlebo, meaning vein, itis, meaning inflammation. And put them together, and you have inflammation of the vein. Thrombophlebitis, the word has two roots, thrombo, clot, plus phleb, vein, plus itis, inflammation, which literally means it's telling us the inflammation of a vein associated with a blood clot. The prefix a or dis means abnormal or without. So an arrhythmia or dysrhythmia is an abnormal heart rate. Tachycardia versus bradycardia. Tachy means fast, over 100 beats per minute, and brady means slow, under 60 beats per minute. Fibrillation is a chaotic, rapid quivering. To fix, we use defibrillation. The prefix D means to remove or undo. We are literally undoing the fibrillation to reset the heart. When coronary artery is narrowed due to coronary artery disease, it causes myocardial ischemia. Myo meaning muscle, cardio meaning heart, and ischemia means a deficiency of blood supply. This causes a suffocating chest pain called angina pectoris. If the blood supply is cut off completely, the tissue dies. This is a myocardial infarction, commonly known as a heart attack. Infarction literally means tissue death due to lack of oxygen. The suffix pathy means disease. So lymphadenopathy is simply a general term for any disease of the lymph nodes. If we change the suffix to itis, we get lymphadenitis, which is active inflammation or infection of the node. A lymphangitis, notice the angio root inside of it, that means lymph vessel inflammation, which presents as those telltale red streaks on the skin. And lymphoma, remember, oma means tumor or cancer. So lymphedema, the suffix edema means swelling. So this is swelling caused by trapped lymph fluid. And splenomegaly is spleno, which is spleen, with the suffix megaly, which means enlargement, and put it together and you have an abnormally large spleen. So knowledge check for you. And we're going to get on to diagnostics and interventions. When diagnosing vascular issues, we use the suffix graphy, the process of recording or imaging, and gram, the actual record or picture produced. Angiography is imaging of general vessels. Angiocardiography is imaging of the vessels in the heart chambers. Arteriography is specific x-ray of the arteries, and aortography is specific x-rays of the aorta. So the same rules apply to the lymphatic system, and the actual procedure, the process of taking the image, or the gram, which is the actual image itself. So when we have electrocardiography, which is an EKG, we have electro, which is electricity, plus cardio, the heart, and then graphy, which is recording. An electrocardiograph, echo means a sound wave. So an echocardiograph is the capturing of the sound waves, the ultrasound of the heart. We also utilize advanced imaging through other means, MRI, CT scans, and PET scans. So some more invasive procedures require entering the body. A prime example is cardiac catheterization. As you can see in the diagram, a long flexible tube called a catheter is inserted into peripheral vessel and threaded all the way into the heart chambers. This allows clinicians to measure real-time pressures and inject contrast dyes right where the blockages are. So these are some other non-invasive. Okay. And when non-invasive treatments fail, surgery is required. The suffix ectomy means surgical removal or excisage. Um, Arthrorectomy is Arthur, fatty plaque, and ectomy removal. Phlebectomy is a phlebe, which is a phlebo, which is vein, and ectomy is surgical removal of the vein. And a hemorrhoidectomy is removal of inflamed hemorrhoidal veins. We can apply the ectomy suffix to the lymphatic system. So you have removal of the lymph nodes, removal of the spleen, removal of the tonsils, and removal of the adenoids. Essentially, if you memorize just that one suffix ectomy, you instantly know the core nature of many of the core surgeries. So, with a cardiopulmonary resuscitation, the cardio part means the heart. When you perform chest compressions, you are manually forcing the heart to pump blood. The pulmonary means the lungs. When you give rescue breaths, you are artificially oxygenating those lungs. So, pharmacological interventions include thrombolytic agents, thrombo meaning clot, plus lytic to break down or dissolve. And these are considered clot busters. Heparin is an anticoagulant, anti meaning against. Coagulant equals clotting, so it stops new clots from forming. Intravascular thrombolysis is an inside vascular vessel. This means we use a catheter to deliver that clot dissolving medicine right inside the vessel where the blockage lives. So, antiarrhythmic drugs, anti against or plus arrhythmia, abnormal rhythm, they fight irregular heartbeats. Digoxin is just a specific drug that increases cardiac contractility, making it pump stronger. And anti-lipidemic drugs, anti-lipid, which means fat, and emic, which means blood conditions. These are medications like statins designed to lower cholesterol and prevent plaque buildup. So, vasodilators relax and widen, dilate blood vessels to lower pressure. Nitroglycerin is a famous example used for immediate relief of angina. Antihypertensives, that's anti-high blood pressure. And diuretics, these are your water pills. They increase urination to lower total blood volume. And here's our knowledge check. So continue practicing breaking down your words into roots, prefixes, and suffixes, and do not hesitate to reach out if you need help.